Hi everybody, Dr. Daniel. Today I'm talking about the use of amitriptyline for sleep. Well, trouble with sleep can be short-term or chronic, but chronic sleep disorders are found in about 30-40% of the world population, and that's a serious problem. Also, certain key neurological illnesses have comorbid overlap with insomnia, and that includes depression, generalized anxiety disorder, all of which are associated with migraine and then migraine. So amitriptyline is a commonly clinically used drug for insomnia, and although it produces side effects, most people can adjust to that and live with it okay. The other thing is it's possible to get multiple help for different medical problems with using amitriptyline. So the doctor could use it for mild depression, for insomnia, or prevention of migraine. One pill doing all of that at one time. Also, amitriptyline has a large range of doses, making it easy for the doctor to choose different doses to adjust to side effects or problems the patient may have. So it comes in dosing from 10 milligrams up to 150 milligrams. And though amitriptyline has been around a long time, it's still a commonly used generic non-addictive drug for trouble sleeping. And it's not addictive. It's not a benzodiazepine drug that requires monitoring like Ambien or Zolpidem, which is a class 4 narcotic. Well, it's not really understood how amitriptyline helps with sleep, but it induces histamine, which may cause drowsiness, and that may be part of the way it works. So in that situation, amitriptyline use is off-label because the indication for the drug was the label would have been depression, and off-label means the doctor used it for another reason than the one the FDA indicated. So it's a drug for treatment of depression, but it's used off-label for insomnia. Possible side effects of amitriptyline include weight gain, constipation, a dry mouth, early morning drowsiness, headache, trouble urinating, orthostatic blood pressure drops. So you stand up from lying or sitting and your pressure drops, makes you dizzy, and blurred vision. My personal experience is that the most common side effects with the drug are early morning drowsiness, a dry mouth, and possible low weight gain. And with the early morning drowsiness, an easy way to adjust that would be to ask the patient to take the medicine earlier at night. For instance, if they're usually going to bed at 10, get up at 7, they're still drowsy but taking the medicine at 7, then ask them to take the drug at 9 p.m. the night before, at which time the next morning the drug will pretty much be gone out of the body and side effects are less. So what typical dose of amitriptyline is used for sleep? I would usually start with 10 milligram size dose and have patients break it into fives, because it'll make it 5 milligrams. You have to cut it with a knife to get a 15 milligram tablet, or then you can adjust it up to 25, 30 or something like that until they sleep better. Then you stop it at that and leave it alone. It's understood that in general, children and adolescents aged 9 to 13 can take the medication, but use lower dose on them than on adults. For treating depression, the common dose there is 75 to 150 milligrams. So there's an interesting mix between using an older drug like amitriptyline that came out in 1961, has possible mild side effects, as with serotonin receptor inhibitors like Prozac, which came out in 1990. Well, no one has ever shown by psychiatric studies, that either one of those groups works better for depression. It's just, and both drugs have possible side effects, but probably the tricyclic antidepressants like amitriptyline have slightly more higher incidence of side effects. Amitriptyline has a black box warning regarding suicidality in children or adolescents who have psychiatric illness. Okay, when I say that amitriptyline is cheap, what I mean? Well, for some drug plans it's free, and others it's like $2 or $3. And sometimes it's cheaper just to pay the $2 or $3 than to use the copay through your insurance, which may be higher than that, like $20 or $15, $20. Amitriptyline can be used in breastfeeding, but has a warning at the 3rd trimester to avoid use at that time from possible fear of teratogenicity, which means harming a baby in the womb. There are a group of drugs that interact with amitriptyline. That includes the monoamine oxidase inhibitors like Aldiprel, Quinidine can cause heart rhythm possible problems. Opioid narcotics can make you drowsy. Epinephrine and norepinephrine drugs could increase your blood pressure. And topiramate, using that at the same time amitriptyline, can raise the dose of amitriptyline and produce side effects. So, in closing, amitriptyline is a cheap, commonly used, non-addictive drug for sleep that's used all over America for sleep disturbance. All right, God bless all you folks who've had trouble sleeping. Thanks for listening to me. Click on subscribe down there, and I'll see you again on the next talk.